What is drug susceptibility testing for TB? Have you ever wondered how doctors know which medications will work against tuberculosis? Drug susceptibility testing, or DST, is the answer. This important laboratory procedure helps determine if the bacteria causing tuberculosis, known as Mycobacterium tuberculosis, are sensitive or resistant to specific anti-tuberculosis drugs. This information is crucial, especially when drug resistance is suspected or confirmed. DST is performed outside the body, often using samples from a patient's sputum or other clinical specimens. The testing can be done using two main methods. The first is called phenotypic testing. This involves growing the bacteria in the presence of various anti-tuberculosis drugs. If the bacteria grow, it indicates resistance. If their growth is inhibited, it shows susceptibility. The second method is molecular testing, which looks for genetic mutations that cause resistance. This method can provide faster results, sometimes within just 24 to 48 hours. Drug susceptibility testing is especially vital in managing drug-resistant tuberculosis, often referred to as dry TB. This includes multi-drug-resistant tuberculosis, or MDR-TB, which is resistant to the two most potent first-line drugs, isoniazid and rifampin. By identifying resistance to both first-line and second-line drugs, DST helps healthcare providers tailor treatment plans to the specific resistance profile of the bacteria infecting the patient. The process of DST involves several steps. First, the bacteria are cultured from patient samples. Next, these cultured bacteria are exposed to various anti-tuberculosis drugs at specific concentrations. The growth patterns of the bacteria are then observed to determine if they are susceptible or resistant. It is also important to confirm the results by checking for contamination and ensuring that the cultures are pure. In some cases, molecular assays can be used to detect mutations directly from patient specimens, especially when rapid results are needed or when growing cultures is difficult. The results of DST are critical for clinicians. They indicate whether standard drugs will be effective or if alternative second-line drugs, which may be more complex and have more side effects, are necessary. If a patient does not improve after several months of treatment, repeating DST may be needed to check for new resistance. In summary, drug susceptibility testing for tuberculosis is an essential tool in ensuring effective treatment. By identifying which drugs the tuberculosis bacteria are sensitive or resistant to, DST helps improve patient outcomes and plays a significant role in controlling the spread of drug-resistant tuberculosis strains. Always remember, if you have questions about tuberculosis or treatment options, consulting a healthcare professional is the best course of action.